No one casually boards a plane for surgery. Choosing dental treatment abroad is not impulsive. It is deliberate. It is researched. It is emotionally complex. So the real question is, what makes a patient trust a clinic thousands of miles away? Today we examine the psychology, risk perception, and decision-making architecture behind dental tourism. Because understanding demand is just as important as understanding supply. Every patient makes a mental calculation. Savings versus risk. The decision-making typically includes financial savings, perceived quality, travel logistics, clinical safety, post-treatment continuity. If the cost difference is minimal, the patient stays local. If the cost difference is significant, 60% or more, patients begin evaluating the risk. This is where perception becomes critical. In behavioral economics, we call it risk-adjusted value evaluation. Patients do not ask, is it cheaper? They ask, is it cheaper and safe? That "and" determines everything. Modern dental tourist is highly informed. Their research process often includes Google search, clinic website analysis, review comparison, social media review, direct communication, video consultation. They look for before and after cases, consistency in patient feedback, transparency in pricing, responsiveness in communication. Slow email response reduces trust. Rate pricing reduces trust. Unclear credential reduces trust. Trust is built incrementally through digital interaction. In fact, decision to travel is often made before direct human contact, based purely on digital credibility. Professional signaling is powerful in healthcare. Patients look for international certifications, recognized implant brands, accreditation logos, clear sterilization protocols, transparent clinical explanation. Visual evidence matters. High-resolution clinic photos, modern equipment, clean environments. These cues reduce perceived uncertainty. The absence of these signals increases psychological friction. In healthcare marketing, confidence precedes commitment. Digital treatment already involves anxiety. Traveling abroad adds another layer. Fear of complications, fear of communication breakdown, fear of being stranded, etc. Clinics that succeed address emotional reassurance directly. They provide dedicated international coordinators, structured travel plans, clear timelines, follow-up guarantees. Reassurance is not optional. It is strategic. What finally converts interest into booking? Usually a combination of transparent cost breakdown, clear treatment timeline, personal consultation, social proof, flexible scheduling, etc. At this stage, trust outweighs cost. The patient feels informed, respected, and secure, and security drives action. Dental tourism is not driven by desperation. It is driven by informed decision making. Patients today behave like analysts. They evaluate risk, credibility, value, and reassurance. In the next episode, we will examine how clinics strategically build digital trust and transform visibility into international patient flow.